polio, chickenpox, whooping cough, measles. Can they be easily reintroduced to a non-vaccinated population? In just the past 4 months, Hawaii residents reported 5 times more cases of the mumps than the total number of cases reported in the past 10 years. And 45% were at high risk for serious complications because they were adults. Vaccines and the risk of opting out. This live broadcast and live stream of Insights on PBS Hawaii start now.
Aloha and welcome to Insights on PBS Hawaii. I'm Daryl Huff with Hawaii News Now. The mumps is a highly contagious viral disease and its effects are generally mild. On rare occasions, though, complications can be serious enough to lead to meningitis, deafness, or swelling of the brain, testicle, or ovaries. There is a vaccine available to combat the disease. It is usually received in 2 doses. Children are usually given one between 12 and 15 months, and the second between 4 and 6 years. Public health officials say less than 4% of school-aged children here have the religious exemption to avoid vaccination. The increasing number of cases of mumps statewide involves both children and adults, both vaccinated and unvaccinated. There have been also large outbreaks of mumps in other states, such as Texas and Missouri. So why is there now a resurgence of a disease which virtually disappeared when a vaccine first became available? What is behind an outbreak like this one? Public health officials talk about the importance of herd immunity. What does that mean? And there are still lingering concerns regarding the safety of mandatory vaccines. Joining us tonight for a discussion on the vaccines and risk of opting out, we have a public health nurse, a specialist on infectious diseases, a naturopathic physician, and a native Hawaiian cultural practitioner. We look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll find a live stream of this program at pbshawaii.org and the PBS Hawaii Facebook page. Now to our guests. Dr. Marian Bellish is a world-renowned infectious disease specialist. She is the division chief of Pediatric Infectious Disease in the Department of Pediatrics at the John A. Burns School of Medicine. Dr. Mellish is also the chairman of the Infection Control Committee for Kapiolani Medical Center for Women and Children. Daniel Anthony is an intuitive agriculturalist, we'll ask him later what that means, with a focus on indigenous lifestyle practices that make the land and people healthy and abundant. He is a traditional poi maker and taro farmer. Mr. Anthony is also the father of 5 children, another on the way. None of his born children have been immunized. Joan Takamori is chief of the State Department of Health's Public Health Nursing Branch. She has spent nearly 30 years in public health nursing. Her division works with the DOE, training school health aides, and provides community outreach to promote public health. And Michael Traub is a naturopathic physician who has been practicing in Kailua Kona on the Hawaii Islands since 1985. He is past president of the American Association of Naturopathic Physicians and served as chair of the Hawaii Board of Naturopathic Medicine for over 12 years. Let's start off by taking a quick look at the trends across the country and in Hawaii. We have a couple of graphics to show you. Across the United States, if we look at mumps cases, in 2006 was the last big spike with over 6,000, nearly 7,000 cases nationwide. And 10 years ago, 10 years later, last year, 2016, there was another big spike, nearly 6,000 cases. And in 2017, it seems to be trending down so far a little bit more than 3,000 cases. In Hawaii, though, the spike has been spectacular this year. And in fact, it adds up right now. It says 172 there. We're told today that number has risen to 185. That is more than 5 times the combined total of the past 10 years in Hawaii. That's a tremendous jump. And let me start off with Dr. Mellish. What is mumps and what does it do to you? And what's the danger from getting it?
Well, mumps is a generally mild disease that when it affects children often involves the salivary glands in their neck, the sides of their cheeks, and the area under their chin. Because it does affect glands, it occasionally, quite rarely actually, can affect other glands in the body, particularly the pancreas and the reproductive glands, the ovaries and the testicles. And those complications are somewhat higher in adults than in children. Rarely, it can cause encephalitis, which is a swelling of the brain, or meningitis, which is inflammation of the covering of the brain and the spinal cord that causes stiff neck and headache. But the more severe is encephalitis. And rarely there are permanent complications. Sometimes deafness and sometimes brain damage.
Is this one of those diseases that if you catch it early, it's easily treatable?
Well, there are no special treatments for mumps. We generally tell people to stay home, rest, drink lots of fluids, and control their fevers.
Run its course, basically.
Run its course. And in the 185 patients that have had it in Hawaii this year, no one has been hospitalized as a result of their mumps. But it has spread because it's quite a contagious disease.
Let me ask Joan Takamori from the Department of Health, where are we seeing it the most? Is it all across the islands or in certain places? What kind of folks are getting it?
It's hard to be specific on which island. I think we're not isolating in one place. People live in one place, you work in one place, you play in another, it's all over. So it's not really focused in one area. However, it is right now 167 on Oahu, 15 on Kauai, and 3 on the Big Island. However, we really want to focus on the fact that we're all over. We don't sit in one place. And so we have to be really cautious on preventive measures to really minimize the spread of the disease.
You know, Michael Traub from the Big Island, have you seen mumps over there yet?
I've never seen a case of mumps in my entire career.
Wow, well that says something about what's going on now, right?
Yeah.
Are you concerned about coming across it, given what you're hearing?
I'm concerned because, as Marion said, it's a very infectious disease. It's like the flu, it's a viral infection, and there's no specific treatment for it other than prevention. So I am concerned about it. One of the things that naturopathic medicine can offer if somebody does have mumps is kind of general immune support through natural medicines. That's one of the things that we excel in when there is no, standard conventional treatment.
You know, Daniel Anthony, we'll talk a little bit more about vaccines and whether people should get their kids vaccinated. So I know you chose not to have yours vaccinated, but I'm wondering, just as a parent with a lot of kids in school, what are your concerns when you hear these kinds of numbers out there?
Well, it makes me want to make sure that my kids have a really good diet and that they're getting lots of sleep and drinking lots of water. The same thing that they would recommend for someone that has the mumps is what I recommend for my kids every day.
You know, we introduced you as intuitive agriculturalists. Could you just tell us a little bit about what that means?
Well, here in Hawaii, we have all different sorts of environments. And so if you sort of have a rubber stamp for mechanism for agriculture, it's not really going to work. So really what I've focused in on is Korean natural farming and indigenous agricultural practices that really look at what wants to grow in that area and how to make it grow better. I also focus in healing soil, because right now in Hawaii, that seems to be one of the biggest challenges, is our soil is not healthy.
Let me get back to Joan. What kind of things is the Department of Health doing about this outbreak? What are the steps that are being taken to get it under control? What kind of things should people be doing?
So in addition to managing the outbreak, doing the investigation, we're really wanting to do a preventive approach. So what we're doing is really asking the community for their help in not just spreading the disease, but spreading the message of prevention. And part of that is vaccinations, in addition to healthy hygiene habits, such as proper hand washing, coughing in a tissue or your arm, staying at home when you're sick, and really not sharing any types of utensils, cups, and that sorts of things to prevent that spread.
You know, Daniel had a good question before we came on. You know, he thought he might have been exposed to someone on a travel recently. Doctor, is there anything you should do if you feel like you've been exposed to someone who has mumps?
Well, you need to watch for symptoms, starting the average time from your exposure to getting ill is 18 days. So any time from 12 to about 25 days. If you have symptoms and you're uncertain whether they're mumps or not, you can phone a physician or get in touch with the Department of Health, tell them what your symptoms are. Preferably stay home. Don't necessarily go to the doctor's waiting room and stay there for a long time where you might infect a lot of people. Don't go to work until you know. So you may have fever, You may have aching in the jaw. Many people just appreciate that they have swelling in their necks, cheeks, and under their chin. And many people, at least a third of people who have been exposed to mumps may become ill, may not become ill. They're just going to become silently immunized by a natural route.
Joan Takaburi, so what is your advice to the public in terms of if they think they've been exposed, should they go get a shot?
So if they've been exposed, what we're asking them to do
Excuse
is,
me.
yes, same as Dr. Mellish, is to contact your physician and check, because exactly the 12 to 25 days, if you have been in contact, you may be showing the symptoms at that time, and exactly that, you may also be possibly spreading that to others. So the main thing to do is contact your physician as well as contact the Department of Health. And on our website, we do have the number to contact for disease investigation.
So if you're exposed, you think you may have been exposed, you don't have to run out and get vaccinated, but how do we know if we may have been vaccinated, and how effective is the vaccination in terms of, I think I heard somewhere that many of the people who are getting mumps this year have been vaccinated. What's going on with that, Doctor?
Well, any vaccine will have an efficacy rate. Mumps vaccine is made from a weakened mumps virus, and the efficacy rate is estimated to be about 88% after 2 injections. The range is from about 65 to 95%, but that's just statistical treatment. So 88%, that means out of every 100 people who've been exposed, 12 might be expected to get it, and the remaining 88 would be protected. If mumps is in your community and you're concerned that you haven't been immunized and you want to get vaccinated, this is what we advocated during the hepatitis outbreak. It was quite effective. So before your exposure is a good time to get immunized. And once again, to remain healthy and do all of the proper things for hygiene. Just as he said, hydration, sleep, a decent diet, and if you think you're becoming ill, stay away from other people that you aren't constantly in touch with.
Have we got any explanation, though, for why in Hawaii it seems to be such a pronounced spike as opposed to other places? I mean, is it the number of visitors we have, or do we have any idea?
No, from the Department of Health, I don't have any information on that. I can check, but again, we travel, we're moving around. It's really hard to determine where that would be.
So it clearly was introduced, but we know that there's outbreaks in the Marshall Islands, in many, many states in the United States, and it happens that in terms of numbers, the CDC just put out a map across the United States. There's a lot of, we're in the second highest category right now. Washington State, as you mentioned, some of the southeastern states. Interestingly enough, it's often being seen in universities or places where young adults are congregating, and a certain degree of the vaccinated are getting it as well as people who are unvaccinated.
Do we have an explanation? I don't know if any of you folks have been following this so much, but is there an explanation for why, after so many years of virtually so little occurrence, there would be these spikes?
There is a kind of a natural history of infectious diseases. You can see ebbs and wanes of them, ebbs and flows of them over history. The effectiveness of the mumps vaccine has been enormous. I mean, before the introduction of the vaccine, it was a very common childhood illness, and after the vaccine was introduced, it basically reduced the rate by 99%. So it's a very, relatively, it's a very effective vaccine. Like Marion said, every vaccine has its own kind of effectiveness rate, and some vaccines are very effective, and I think the mumps is in that category, and others are not very effective. One of the things I wanted to point out is that typically with mumps, people get flu-like symptoms before they get the swelling of their salivary glands. So at this time of the year, the flu is not very common. So I would just like the audience to know that if you have flu-like symptoms, even if you don't have any soreness in your jaw yet, you should probably see your doctor and be tested for mumps.
You know, I want to bring up something now that we have been talking about a little bit. This discussion does raise these doubts that people do have about vaccinations, mandatory vaccinations. If you wouldn't mind, Daniel, could you pass me that that statement there? A woman named Nicoles, a registered maternity nurse of 20 years, wrote us a detailed letter about how she never questioned the safety of childhood vaccines until 3 years ago, when events in her life led her on a personal mission to research vaccinations. She begins by questioning claims made by the pharmaceutical company that produces the MMR vaccine, which I believe is measles, mumps, and rubella. Merck is currently in court, she writes, because they falsified the data that proved the efficacy of the mumps part of the MMR vaccine. They claim that the MMR vaccine has over a 90% efficacy rate. Not true, it's closer to 65%. Because of the vaccine failure, we have now placed our post-pubescent boys at risk. Once again, this is a letter from Nicoles, a registered nurse. I am not anti-vaccine, she writes. I believe we should all have a choice on whether or not we want to be vaccinated and to what degree. We hand our patients or the parent a vaccine information statement prior to the vaccination. The back page says, ask your doctor to give you the vaccine package insert. And she writes, if you read that insert, would you still give your child the MMR vaccine if you read that it contained formaldehyde, polysorbate, aluminum, aborted fetal tissues, or that the side effects include seizures, convulsions, transverse myelitis, encephalopathy, atypical measles, diabetes, mellitus, arthritis, etc.? She writes, our government has paid out over $3.6 billion in compensation since the National Vaccine Injury Act was passed in 1986 to the vaccine injured. The pharmaceutical company has no liability if you or your child are injured. Food for thought. Dr. Mellish, let me give you a shot at that. What things in this statement do you think are most important to talk about?
Well, I think it's important to talk about vaccine efficacy, which we did talk about. And that figure of 65% is the lowest possible efficacy rate. But as you said, the effect of the mumps vaccine in the United States has been really profound. The other diseases that are prevented, measles and rubella, actually have more severe consequences than mumps, and this is a valuable vaccine.
Do people tend to lump all of these different vaccines together into the one and then conflate all the positives and negatives in their arguments?
Well, that does happen. And there are very rare adverse events associated with vaccines, some of which are likely due to the vaccine, some of which are likely coincidental findings. But I can say that as 50 years practitioner of infectious diseases, I have stood by the bedside of children who are dying or have been badly damaged by the diseases that we can prevent. And very rarely have I seen children who have been seriously damaged by vaccines. When you have gone through this experience, when you've seen we have the virtual disappearance of certain diseases and the actual disappearance, for example, of smallpox, we have and the virtual disappearance of polio, almost from the world. Polio is just about to be eradicated. You realize that prevention is far better than dealing with the consequences of disease. By experienced disease, we all get immunized. It's a very good immunizing experience, but you need to survive it and not be damaged from it.
Michael Traub, as a naturopathic physician, how do you feel about the vaccinations and the pros and cons?
Well, it's a very controversial subject. And a lot of what these notes said, her name is Maya? Yeah. There's some truth to what she says, but there's some other things that are inaccurate. And in this conversation about vaccinations, sometimes it's very, very difficult to really know the truth, because there are elements of vested interest, both pro-vaccination and anti-vaccination, and a lot of the common arguments that are made, both pro-vaccine and anti-vaccine, are not really based on accurate information. There's a lot of fake news in this situation.
But on both sides.
Yeah, yeah. And so she mentions Merck being sued. Well, filing suit is not that difficult to do.
Anybody can get sued.
Yeah,
Anybody can
and,
sue.
and it's the outcome that's going to make a difference here. The CDC is also being charged with falsifying information about the measles vaccine. And you asked about conflating these, vaccines all into one. In this case, the measles, mumps, rubella vaccine are vaccines combined for 3 diseases. They're not available in this country as individual vaccines.
Joan Takamori from the Health Department, do you run into this resistance a lot when you're out in the field?
We have some resistance, but it is a parent's choice. However, one of the things that we do with the Department of Health is really provide the information so that the parents can make that informed decision on what choice they do make. However, we really want to focus on the prevention. I know we're talking a lot about the disease, the symptoms, what do you do when it occurs? And I think the message we're trying to get across is prevention. And the key thing is don't wait till you get it. If you haven't gotten your immunizations or your vaccines, we do recommend both vaccines. The other thing also is really doing some of the simple hygiene practices that we're supporting. So don't wait till you get it, but really practice these preventive aspects to support
Let me
that.
ask though, I mean, when you say the Department of Health recommends these vaccines, for the most part, are we talking about the childhood vaccinations, or are you talking mostly about adult vaccinations, or what are we talking about? Childhood vaccination, right?
So we're supporting all. So when we're looking at the Department of Health and what we're supporting, it's for the children, yes, for the age group of 12 to 15 months, that is what we're looking at. And getting the second dose right now, we're supporting 1 month later. In addition to that, for adults, if you were born in 1957 or after, we do recommend 2 doses of the vaccine.
I got to do the math in my own head for me. We did have a number of questions now coming in, and one specific question for Daniel Anthony. Can the father on the panel talk more about his choice not to vaccinate his kids? Does he homeschool his children since public schools require vaccinations? We'll talk about that a little bit later. That's not quite true, but we'll talk about your choice to not vaccinate your own.
Look, as far as our family is concerned, the health of the family is the lifestyle practices that we have. So we haven't eaten imported rice as a staple in our house for 10, 15 years now. The poi bowl that sits in the middle of our table hasn't been emptied in the last 8 years. There's a sense of beneficial microbes that is a part of our life. When I say intuitive, you hold your child at the hospital and the first thing that they want to do is inject your child. And so for me, how did that feel? It wasn't something that I thought was necessary. Humans have been having children for a really long time. And this wasn't necessarily a part of it until the recent modern industry. I believe that if at home you have good practices, you're clean, right? Hand washing is so big. As a poi maker, one of the things that kids do not realize is how often they're touching their face, they're touching each other. So when your kids regularly wash their hands, not just when they go to the bathroom, but as a part of what they do on a regular basis, these are the things that we teach our children. Getting in the dirt, being a part of the environment. We don't use any antibacterial soaps. We don't use any antibacterial wipes. We hope that our children live in an inoculated system.
Well, tell me, how have your kids done? I mean, have they been healthy?
The irony is my kids spend less time at home sick than most of the other kids at their school. My 2 boys, I actually can't really remember the last time someone was down with the flu in our household. When I'm down, it's usually some type of work-related injury where I pull a back muscle or I sprain something. Outside of that, we're a really fortunate family. We work really hard. We eat really well. We went emutarian in 2015.
Let me let our panelists now respond to what you just heard from Daniel. Doctor?
Well, I believe in vaccination because I do see serious illness cropping up, and because I think that the risk-benefit ratio is overwhelmingly in favor of vaccination for most of the diseases that we vaccinate against. So I do see very healthy children who've been raised in very supportive environments who become ill. I don't think that viruses necessarily discriminate, but there is no question that maintaining health is very important for recovery from an illness or preventing an illness from becoming very severe.
Dr. Traub, let me ask you, how do you feel about what Daniel just described? Is that the way that you would suggest families approach this issue?
Absolutely. I'm 100% supportive of what he does. You know, he was talking about, you know, the benefits of actually getting in the dirt and growing up on a farm is really one of the best things that you can do to develop a healthy immune system. It's called the hygiene hypothesis, and it continues to be kind of substantiated as we learn more about that. As a naturopathic physician, I have a lot of parents that bring their young children to me with the vaccine question. And Joan mentioned that, you know, a lot of this is educating and helping parents make an informed decision. And so I sit down with them and I have a lengthy discussion, sometimes on 2 occasions because there's so many diseases and vaccines to talk about, and go over each one and really discuss the pros and cons. And it's ultimately their decision, you know, about what their preference is. And I think that when you give them material and when you talk with them, it's important to kind of have a neutral attitude and not really be pushing one way or the other.
What way do they tend to go at the end of the conversation?
Well, in my practice, a lot of parents prefer to defer early immunization and wait until the child is older and have what's called an alternative vaccination schedule.
But it's still vaccines from the traditional vaccine providers.
Yes, yes.
Joan, last question. So given what Daniel was talking about, I guess the Department of Health is in an awkward place. You talk about prevention. He's certainly talking about prevention, but at the same time, you're dealing with the whole population.
Yes.
And how does that affect your way of looking at the question?
Well, I definitely support kids playing where they live and supporting building on your immune system. At the same time, with the department, though, we do provide the information on vaccinations, and not just vaccinations, but a lot of the push that we're doing right now is going out into communities, working with the schools to do simple hand washing and those hygiene practices.
Let me ask you a quick question before we do look at a piece of video that I think is very important to the audience. If one has actually had the mumps, is that an effective or less effective than vaccination? If I had mumps when I was a kid, should I not worry about getting vaccinated?
Generally, yes. It's perhaps not true for every infection, but in general, having a natural disease provides a very strong immunologic challenge, and if you've met it and recovered from it, you probably have longer lasting immunity.
Because when you mentioned the 1957 date, I was like, well,
Yes.
that's when I was born, and I was thinking, gee, I think we went to mumps parties. I think I did.
Mumps parties.
Yeah, we had mumps parties, just like measles parties. So now let's talk a little bit about this issue as presented by the award-winning PBS Public Affairs program Frontline, which has closely followed what it calls the vaccine wars across the country. Here's a segment of a Frontline program from an Oregon town where a well-off, educated community hesitates to vaccinate its children.
What a cute little face. Aww. Here we come. It's a girl! She's beautiful. What's her name? Rachel.
A new life begins.
Congratulations.
Out of her mother's womb, Rachel Murphy is now surrounded by a new world filled with countless germs. Modern medicine will do what it can to protect her.
Just a tiny little stick.
Barely an hour old, Rachel gets her first shot against hepatitis B. This is the first of up to 35 inoculations she will get in the next 6 years of her life to fight 14 diseases.
Princess.
Public health doctors celebrate vaccines as one of medicine's shining achievements.
That's all, okay.
They've increased our lifespan by 30 years. Hib would cause 20 to 25,000 cases a year, gone. I mean, polio would paralyze, tens of thousands of children every year, gone. I mean, diphtheria was the most common killer of teenagers in the 1920s, gone. I mean, the vaccines, the benefit of vaccines is clear.
Well, there's now 16 diseases that are preventable by vaccination for children. 14 of those are diseases that we vaccinate infants and young children for, and 2 of them are diseases that we vaccinate adolescents. From my point of view, being able to prevent 16 diseases by vaccination is a really good thing.
But not everyone agrees. Across America, the CDC has discovered certain communities where parents are hesitating to vaccinate their children. One is Ashland, Oregon.
Yeah, what am I going to do with the baby scooter? This is our neighborhood. We love it because we can walk everywhere. Ashland is a very safe town compared to almost every place else in America.
It's a college town, the home of an annual Shakespeare festival, where a well-off, educated populace has easy access to alternative medicines, an organic food co-op, and yoga centers.
Go get 'em!
Jennifer Margolis, a writer with a PhD in English literature, is the mother of 4 children.
When my daughter was born in 1999, the nurse bustled in with her tray and said, "Okay, it's time for your hepatitis B vaccine." And I looked at my daughter and I looked at the nurse and I said, "Isn't hepatitis B a sexually transmitted disease?" And I said, "Why am I supposed to vaccinate my newborn baby against a sexually transmitted disease?" And the nurse got really mad.
Margolis went on to research and write about vaccines, and in 2009 published a long article about the vaccine debate in Mothering Magazine, a magazine promoting a natural lifestyle.
Why are we giving children so many vaccines? They get 4 times the number of vaccines than I got when I was a child growing up in the 70s. As a parent, I would rather see my child get a natural illness and contract that the way that illnesses have been contracted for at least 200,000 years that Homo sapiens have been around. I'm not afraid of my children getting chickenpox. There are reasons that children get sick. Getting sick is not a bad thing.
Dr. Bellish, what are your thoughts hearing that woman's statement and hearing about a town where there's quite a few people that are not vaccinated? Of course, that is a college town. My daughter goes there, so I'm like, whoa, okay.
Well, very likely your daughter was asked to have her vaccinations up to date because there are particular risks for college students, for example, for epidemic diseases, including meningococcus and now mumps, which is in college communities. But I think the biggest trouble with any community where there are large numbers of people who are unvaccinated is that these vaccine-preventable diseases can spread more easily than among populations where a high proportion of people are immunized.
I'm sorry.
So that goes to herd immunity, which you were...
We're gonna get to that very shortly. We're gonna talk about what is the theory behind these major vaccination programs. But Daniel, I imagine you can relate to what that lady was talking about.
I definitely do. You know, I did have a question. For the research on these vaccines, how many Pacific Islanders or Asians are studied when they do the testing? Because that was in part of the research when I went and asked about my own children. You know, the ethnic diversity of my kids is such that, you know, if there was going to be a chance of having some type of system, some type of reaction, you know, where the doctor could never answer who they tested it on, what kids, what ethnicity. And so for me, I feel like Hawaii is a really unique place. And we have kids that are so multicultural, yet in the huge percentage of how many hundreds of millions of people there are in the United States, we don't necessarily ethnically wise, you know, we're not a majority.
Joan, could you respond to that?
I wouldn't have the answer for that. I would defer that to Dr.
I think
Bellish.
that, you know, to immunologists, we haven't yet discovered, there very likely will be differences. There's a lot of differences within the genetic code that are being found. But in general, most humans have evolved to have a rather sophisticated immunologic system. We have both natural innate immunity, and we also have this system of learned immunity, where your body encounters some antigens and learns to recognize what is foreign and what is not. Vaccines have been tested in people all across the world. A lot of vaccine work was one time done on Kauai. There's a famous study on rubella from the children of Kauai. So most likely that included a lot of Pacific Islanders as well. Actually, Hawaii is a pretty good place for vaccine research because we don't have such a mobile population. If you want to be able to study people on a longer term basis, this is a good place to do it.
Let me move on. Dr. Traub, do you feel that there is actually harm done by vaccines? I mean, I think that's where I'm starting to get a number of questions. I'm going to bring these up. Do you feel overall vaccines pose more of a risk than a reward for individual families?
I think there's two ways of answering that question. One is an individual child, and the other is the community. And overall, with the community, the benefits of vaccines outweigh the risks. But when you're talking to parents about their child, they are more concerned about the welfare of their child than the community. And so you have to kind of address it from that point of view.
It's a fascinating question. We're going to get to that issue very shortly with another video, but I want to get through some questions. And this kind of goes to what was in the video, and I know the concern you had too, Daniel. Currently, children get multiple vaccines at the same time. Does Dr. Bellish or Ms. Takamori know of any scientific studies of the interaction of multiple vaccines given together?
Well, this has been very carefully studied. And in fact, the children are seeing fewer antigens, which is individual components that they need to react to, than they were with the old seven vaccines.
Oh, so it's been rolled back a little bit?
Well, there have been vaccines that used to have hundreds of antigens in them, and that have been reduced to 2 or 3 to increase the safety in general, so that the antigenic load is not as high as it used to be, even with the larger number of vaccines that we have. In addition, the immune system, when it encounters a microbe, the immune system has to respond to hundreds of individual antigens. And so the immune system is very capable of doing that. And one of the reasons why you want to immunize people early in life for most of the things that we immunize to is because they're bigger problems in the younger children. So that, for example, delaying immunization against one of the meningitis bacteria will increase the risk that the child will get it. And we've almost eliminated that disease.
That's a
the
pretty
countries
terrible
that
disease.
did it later have had to deal with 2 generations before they started to do immunization.
Let's move on now to another video, and this is part of what came out of a 2015 measles outbreak that was traced back to Disneyland. Most of the 125 people infected were unvaccinated, and subsequent outbreaks occurred in communities where the vaccination rate was below 95%. This triggered an aggressive movement in California to end the religious and individual belief exemptions filed by many patients and parents to avoid vaccinating their children. From another Frontline report, we learned why health officials refer to herd immunity as the only defense for the most vulnerable among us.
5 years ago, when we last reported on the vaccine war, public health officials were struggling. It was a challenge to explain the importance of herd immunity. But now the political landscape has changed because of the rapidly unfolding measles outbreaks like the one that started at Disneyland in California. The outbreak there, public health officials say, is a sign of poor herd immunity, caused by parents using the personal belief exemption to opt out of the mandatory vaccine schedule required for attending public schools.
There are essentially 2 types of non-medical exemptions in this country: religious exemptions and personal belief exemptions. The way those 2 types of exemptions are administered around the country vary widely. In some places, you essentially just need to say, it is my personal belief that I should not vaccinate my child, and sign a piece of paper, and that's that.
Reed Elementary School in Marin County has traditionally made it easy to obtain such exemptions. But now some parents have pushed back, saying that such policies put certain kids at risk. This is 7-year-old Rhett Crowett. He's lived with leukemia for most of his young life. He has endured multiple medical procedures and over 50 surgeries. 90% of such cases are eventually fully cured, but the treatment wipes out the immune system, making vaccinations impossible.
Okay, you ready to go, Rhett?
I'm very ready. When he was first diagnosed, he was pretty much pulled out of society. We avoided highly concentrated groups of people. When we went out, we wore a mask. I mean, we really did limit his exposure. And we just were so excited for the day when he could start kindergarten so he could have that sense of socialization and community and learning.
A year into remission and back in school, Rhett will soon be healthy enough to be fully vaccinated. But until then, his life depends on herd immunity. And Marin's high rate of non-medical exemptions therefore puts kids like Rhett at risk.
We also have talked to our volunteers.
That's what this school board meeting is all about.
So at this point in the meeting, what we're going to do is turn it over to public comment.
Rhett's family has come to argue that Reed Elementary should bar unvaccinated kids who don't have legitimate medical exemptions.
This story isn't about Rhett anymore. It's about the hundreds of kids currently with suppressed immune systems that rely on the science of herd immunity. Please eliminate the personal belief exemption as a condition of attendance at Reed.
My name is Rhett Krawick. Leukemia is cancer in my blood.
Rhett has become a poster child for the pro-vaccine camp, which is now on the offensive, with California politicians considering new legislation to repeal personal belief exemptions.
My name is Dr. Richard Pan. I'm the state senator representing District 6 in Sacramento, and I really have made extraordinary efforts to be sure that our children are safe.
And there are similar plans in other states.
What do you want the board to do?
To make sure everybody gets vaccinated.
Have you talked to your pediatrician?
But vaccine watchdogs like Barbara Lowe Fisher oppose such legislative attempts to limit parental choice, turning again to the internet.
The battle lines are clearly drawn. Now Americans have a choice to make. Will we stand up and fight to protect our freedom, to make voluntary decisions about which vaccines we buy and use? Or will we permit liability-free drug companies and government health officials to take that freedom from us?
Dr. Bellish and Joan Takabori, what's the status now in Hawaii for people taking exemptions or being exempt from vaccination?
So what we have in the system right now is that parents can take religious or medical exemptions. We do see a lot of medical exemptions because of situations such as that child that you just saw in that video.
Religious or medical?
Religious or medical.
Okay.
So with medical, such as that child, if they have a condition that they aren't able to take any vaccinations yet, we do allow them and they have that exemption. And there is also a religious exemption that is allowed also.
So we don't have this personal choice exemption that was mentioned in the video?
That's correct, but many people use the religious exemption because it's very permissive. You don't have to belong to a certain church in order to get a religious exemption.
It couldn't really, it'd be hard for a doctor to say, well, what's your religion and why does it exempt you?
Yeah, it's really not the doctor that is involved in this, in the exemption and the waiver. It's the parents and the health department.
And does that have to do with whether you can go to school? Is that where the key enforcement is, whether the child can go to school?
So yes, we have health requirements for when the child enters the school setting. And these are requirements that are looked at and we do track. And so we do, if they are coming in without any immunizations, it is going to be either a religious or a medical exemption. But one of the things that I just want to really stress from the Department of Health, we do understand that there is personal choice from the family. But also the issue is around situations such as this, where we really want to protect the community as well. And it's not just about but it's about we and how we support and keep our communities healthy.
You know, Daniel Anthony, I'm familiar with your family, and I know that your kids, when I visited, they go to a charter school.
Yep.
Did you have any trouble getting them into school, or did you have to justify not having them immunized when they went to school?
We had to get a religious exemption.
And then how did you do that? What did you cite? Did you have to cite anything, or you just fill out a piece of paper?
It's pretty simple. I mean, you know, I think they want to give you room, and they don't want to corner you on this. You know, for myself, What concerns me is when one student impacts. I mean, it's almost the equal of sending your kid to school sick. If all the kids have to participate, if me as a parent in that same situation, my child wouldn't have went to school. You know, I would have just homeschooled my kid for a couple of years till they were able to be out and play with the rest of the kids. I mean, I think that's another thing as a parent that we have to think about, you know. How does our actions impact the other members of the community?
Well, I mean, just I think that, but the other point would be is if your kids aren't vaccinated, then they're putting other kids at
But
risk.
this child had a special condition, you know, a case, and they knew about it. So if my kid has a special condition and I know about that, then I'm going to treat my child a little bit more particular and not expose them to the risk. I mean, if my child is going to die or get really sick if they catch one of these viruses, then I'm going to do my best to limit that. And
But that would mean, I think, Dr. Melish, I mean, that would essentially mean that child could never go to school under that scenario.
What I think is that the reason why school vaccination as a condition of school entry was enacted was not to restrict people's freedom. It was to encourage immunization. In a system that we have with in our state, we have a relatively small number of people who don't immunize their children. Maybe a larger group of the non-immunizers use an alternative schedule. But we have seen pockets of disease among certain groups and certain areas of our communities where immunization rates are low. So school entry requirements are a way of getting most people to immunize their children or encouraging immunization. The higher the immunization rate, the better the community is protected. And from time to time, there will be importations of viruses that can cause problems. I think most of the time, we are looking at conditions and wishing that we had more vaccines. When, for example, something like dengue that we don't have vaccines for is coming into our community, we certainly saw the problem with unimmunized people and hepatitis A, far more serious disease than mumps.
Yeah, maybe mumps isn't the best disease to talk about when it comes to an immunization thing because there are much more serious diseases that are prevented by vaccines.
But it was extremely common and it's extremely contagious. And I think very many people are glad that their children are not going to get mumps anymore.
Dr. Traub, talk about the ethics of this. I mean, you say you have individual families who may choose not to get vaccinated or on a different schedule. Do you talk about the ethics of that? Or maybe your child might get something and give it to another child and that kind of becomes an issue?
Yeah, I do. I think that the topic requires a wide-ranging discussion, and that is an important part of it. The problem is that there are many pediatricians nowadays who don't allow children who are not fully vaccinated into their practice. And this is an area where naturopathic physicians who are, you know, more open-minded, you might say, about parental choice in vaccines, to provide medical care for those individuals who are not immunized or who are not fully vaccinated or who prefer a alternative vaccination schedule.
Okay, have gotten backed up with my viewer questions, and we've got about 5 or 6 minutes left. So let me get to some of these. One, I am an immune patient, and I rely on other people to protect me. I am 100% pro-vaccine. Joan Takamori, what does she say? Help me understand what she means. She relies on other people to protect her.
Well, I think what she's saying is that she wants folks to get vaccinated so that we are protecting not just ourselves, but our others that are around us in our communities.
Is that how you feel about it? Is that a major point you feel for vaccination?
Yes, within the Department of Health, that is what we support.
Okay, another caller works at an elementary school. She has seen students transfer from schools who are not vaccinated. She feels there's no excuse for students to not get vaccines because they have free medical clinics that they can go to. Is expense an issue around the vaccine discussion at all?
Not for children.
So it's
at the present
covered
time
entirely?
Not for children. And within the Department of Health, we also, in public health nursing, we also do clinics in the public, in the communities, to support that for those that don't even have insurance. But what we're also doing is connecting them to insurance as well as to their primary care providers.
Because I know when there are outbreaks, there was a tendency to have free vaccination available.
So the Department of Health does support that through our immunization clinics throughout the state.
Okay, another question. Of the 185 cases of mumps in Hawaii, how many patients were vaccinated? Maybe this is a chance to step back into the mumps discussion. Adults, children, I mean, did we know how many were vaccinated? I know that they were saying about 50-50.
All I can say is it's 49% that were adults 18 and over. However, we don't have that data that identifies how many were unimmunized or not. And again, it is, with the 2 doses, 88% effective.
That reminds me of the question that came in earlier about how much of our population is vaccinated. Do we know how many people are using the religious exemption?
I don't have that data for you right now, but that's something that I could get.
Generally, are we over 95% in this community? Do we know?
Our childhood vaccination rate is relatively high. So we have generally a population that's open to immunization. But there are pockets of, just like they talked about Ashland, Oregon, there are communities where there are a larger percentage of children that are not vaccinated. Vaccination is available for children, and in the face of outbreaks, it's usually emergency vaccine supplies usually become available.
You know, when I was in the medical world, I remember it was very difficult to get the rate of early vaccination up in some populations. There are some communities where it was hard to get up. And my impression wasn't so much it was people who were exempting themselves because they thought about it, just that they didn't stick around to have their kids immunized. They just had their babies at the clinic and left. I mean, in the Big Island, I imagine there's some of that, right?
There's some of that. I think it's a small minority.
Small minority?
Yeah.
Okay. Another question from our viewers. Can the panel please discuss the alarming rates of autism and how that relates to the increased number of vaccinations? I know this is a perennial. Dr. Mellish?
Well, I think this is a question that's been asked and answered. It is true that we don't understand all the causes of autism. It's clearly very strongly genetically associated, more than any other influence. The furor came up about 3 different theories related to the measles, mumps, and rubella vaccine. 1, that it was related to mercury in the vaccines. 2, that it might be related to some damage to the gastrointestinal tract that caused certain proteins that could damage the brain to become liberated, and a 3rd was that it had to do with this idea that a large number of antigens is too much for the human immune system to handle. There's been very strong evidence against all of those things.
My understanding has been pretty thoroughly debunked.
It's been pretty thoroughly debunked.
Doctor, you agree that that's been pretty much debunked, the whole autism connection?
I think that's the perception. I personally still feel, as I mentioned earlier, that there's bad science on both sides of this issue. I don't think that there's any definitive proof that vaccines cause autism, but I don't feel that some of like the governmental agencies, the Centers for Disease Control, are as open to really looking at this question impartially. There's a lot of vested interests in the vaccine business in pharmaceutical companies that makes the vaccines, and so it's hard to really get, I think, balanced.
But overall,
research.
I think you did say earlier that overall you feel like as a community vaccines work.
Yes.
Okay. Quick question from another viewer. Caller was vaccinated against mumps in 1970. Does he need a booster?
Yes.
Yes?
If he had only 1 immunization, 2 is better than 1.
Okay, and finally, overall, do you feel like we should, given the snapback against vaccinations, do you folks feel like we should be tougher to make sure people get vaccinations, or back off and let people make these decisions themselves?
I think it's a matter of education. I've learned things preparing for this talk tonight, both before coming here and also since being here. And most people are making decisions based on very little information. And so I think it's something that the state, given this outbreak, really is responsible for helping to educate the public about, what is going on and what the benefit of vaccination is and what risks, if any, may go along with that.
We're actually pretty much out of time. I want to thank all of you very much. It's been a very educational, and I like your point at the end. Is it something people should pay attention and be concerned about their community and their families individually? And so I'd like to thank all of you for joining us, and you folks at home for joining us. And I'd like to thank our guests personally, Dr. Marian Bellish from the John A. Byrne School of Medicine and the Pilani Medical Center for Women and Children, Joan Takamori from the State Department of Health, Daniel Anthony, intuitive agriculturalist, now that we know that is, and Dr. Michael Traub, naturopathic physician from Hawaii Island. Next week on Insights, we've talked about how visitors are looking for excitement, dangerous hiking trails, and excursions to off-limits experiences. Drowning is the #1 killer, though, of visitors to Hawaii, with nearly 6 drownings per million visitors, way more than other destinations. We will hear from people on the front lines of this concerns over water safety for visitors and residents right here next week. I'm Daryl Huff for Insights on PBS Hawaii. Ahui ho.